action for your health right now. If you're struggling to keep your resolution to lose weight this year, or just maybe you need some motivation and tips to stay on track, we have experts in our studio to help you. Community Affairs Director Lizette Campos joins us now live from a special phone bank. Good morning, Lizette.
Good morning, Dia. Good morning, everybody. That's right. We have experts from across the Tampa Bay area who are here waiting to take your call. The phone number is 1-888-209-8881. These are medical experts, health experts, personal trainers from different areas of expertise to answer your questions about getting healthy, losing weight. That is the #1 goal that most people set in the new year, losing a couple of pounds, getting healthy. And so we've put together this core group of folks, experts from across the Tampa Bay area to answer your questions. Again, the number to call, folks, is 1-888-209-8881. I'd like to begin by talking to Dr. Jay Garcia of Garcia Weight Loss, who's joining us. And Dr. Garcia, the common question is, how do I know how much weight I need to lose? You hear so many things about BMI and all these other things. So what is the most simple way that a person should approach that question? How much should I lose?
Well, the most important thing is to initially figure out how much weight, what you weigh, and then take 10% of that. And once you lose 10% of your weight, you are healthier and you have a 50% less chance of developing diabetes, hypertension. So that would be a very good initial goal. And then, of course, anything besides that is more of an aesthetic, how you want to look,
right,
and how do you feel. Then, obviously, for your height, there should be a certain reasonable goal. And when you get to reasonably to that goal, your body will be more efficient and be able to maintain the weight that you lost.
What about the person who says, I've been on this diet and I can't lose anymore? I seem to have what's called plateaued. They're frustrated. What is your advice for that person?
In general, the patient that plateaus, if they're compliant and they're following a reasonable program, it's because they may not be getting enough calories to keep losing weight. It's counterintuitive in the fact that people think that the less you eat, the more weight you lose, but actually your body, if it's in a starvation mode, as I call it, it will stop losing weight, and it actually will retain body fat, which is a genetic predisposition of our body to do that. So what we normally do is we see if the patient is compliant. Number 2, we then evaluate their activity levels. Number 3, we then go ahead and adjust their plan according to their activity. Our system does that automatically on a week-to-week basis, actually. When they see what the patient lost, it changes the nutritional components of the program.
And is it true that if you lose weight very quickly, you are more likely to gain it back?
Well, I'm glad you asked that question, because even the weight loss Bill of Rights that we have to give the patients say that. But a recent study in Lancet showed that patients that lose weight quickly will regain it the same way as the patient that loses the weight slowly. So that's a myth that's out there.
Worth continuing the conversation. Thank you for joining us, and you've got a call coming in. Again, folks, the number to call is 1-888-209-8881. These are experts from across the Tampa Bay area here waiting for your call to talk to you, answer your questions as our service to the community. So please pick up your phones and call if you have any questions. 1-888-209-8881.
Time now 9.